We have variety of tests like tympanometry, we have B.Sc, audiometry, and we have like a screening test just by air conduction or a bone conduction, because what they do is like they just whisper to the patient and they will ask, can you hear? So the doctor might whisper on the right ear and then on the left ear. If a patient has a problem in the right ear, then he does not hear the whisper properly in the right, but he can figure out on the left side. Same way we have like bone conduction. What they do, they just take a vibrating fork and place it on the forehead, and they will try to understand is a bony conduction is appropriate in the right or left. Sometimes the patient can sense well the conduction on the right side but not so on the left side. With this they can conclude which part of the ear is affected. We have like Stenger Test. It's like the code is 92565. That is for people who pretend to be like deaf. So they can administer this test and figure out if the person is really deaf or just pretending to be deaf. And filtered speech test and conditioning play audiometry, electrocochleography. So they are going to measure the activity of the cochlea. So all of these tests are pretty straightforward, and after placing a cochlear implant, they are going to see, is it being programmed properly? Is a patient able to understand these words properly, right? So we also have so much of evaluative and therapeutic services purely depending on the age factor as well.